what are the incisions for gynecomastia surgery and what's the process after the surgery? So the incisions really vary by what we're trying to do. Most of the time, I make an incision right in the edge of the areola, the colored part around the nipple, and I can take out that tissue right underneath the nipple itself, that breast tissue that's in the nipple. Occasionally, we have to do some liposuction as well. Really, it depends on where the fat is located. Sometimes we have to make an incision, a little small incision, over on the side, over the rib cage. And sometimes we have to make one a little bit lower down in the chest. And those incisions heal really well. In those patients, the incisions, like I said, little bitty incision at the nipple, little bitty incision here, most people don't notice them. Now, if somebody has a lot of extra skin after massive weight loss, they've got a lot more breast tissue, they've got a lot of hanging skin, those incisions may vary a lot more, and sometimes they have to have an incision all the way across the chest. That's a lot bigger surgery. Now, recovering from all these surgeries, no matter if it's a small incision or a large incision, requires you to wear some kind of a compressive vest. What that does is that squishes out all that extra tissue, the swelling from the surgery, and it helps to give you that better final contour. You gotta wear that compression vest for at least 6 weeks. So I usually say this is something to do, usually in a cooler time of the year. Doing it when it's 100 degrees in Houston, not a great thing to do, but it still can be done. Also, you have to think about the restrictions after surgery, because you can't go and do some really physical labor, physical job, or work out really hard right after surgery. Everything needs to sit back down, and you really are kind of restricted for about 6 weeks. No real working out, no heavy lifting. Once you're recovered from that, you don't have to wear your compression vest anymore. You can go along with your life with your new contour of your chest.